Hello everyone, I'm Dr. Waikoni and welcome to Bright Star Baby and Child Clinic. In this video, I would like to talk about a smelly problem, which I think a lot of parents have faced with their children. As a parent, I'm sure that you have changed many poopy diapers, but sometimes you may find that you are changing your child's diaper more often, poopy diapers more often. It becomes smellier. It may be that your child may be suffering from a stomach infection or a tummy infection. That brings us to today's topic, which is stomach flu. Now, what is stomach flu? People always talk about it. It's a general term used to describe a tummy infection or a bowel infection. It is also known as gastroenteritis. Now, what is gastroenteritis? Well, as I mentioned, it's a bowel infection and it's usually caused by a virus. It is sometimes known as a stomach bug or a stomach virus. Now, gastroenteritis is a very common problem and I see it very often in my clinic. It is a mostly benign condition and most children recover from it without any major complications. However, I do want you to know that gastroenteritis or stomach flu contributes about 15% of all child deaths around the world. So it is a serious problem and we have to take note of it. Now, what causes gastroenteritis? I would say that viruses contribute to about 70 to 80% of the cause of gastroenteritis. Common viruses that cause gastroenteritis include rotavirus, norovirus, adenoviruses, enteroviruses, as well as astroviruses. But there are many others more. Now, because there are so many types of viruses that can cause gastroenteritis, your child may get it more than once. Bacteria and parasites sometimes contribute to the cause of gastroenteritis as well, but it is much less common. There may be blood in the poop if bacteria or parasites cause the gastroenteritis. Antibiotics are usually not needed for gastroenteritis or stomach flu, except for certain types of bacterial infection, or if the episodes occur in young infants or those who are suffering from immune problems. What are the signs and symptoms of gastroenteritis or stomach flu? Well, the most common symptom would be diarrhea. What is diarrhea? Diarrhea is basically watery or runny poo that occurs more frequently than usual. Sometimes the person may feel very sick or nauseous and may even vomit. Sometimes a person with gastroenteritis will also have a little bit of fever, headaches, feeling tired, a tummy ache, as well as a loss of appetite. Now, how do children or people get infected with gastroenteritis? The most common way is that it is spread through hands that touch something that is, or someone that is infected with the virus. So if your hands come in contact with a person who is infected, who has soiled hands, or if you touch a surface that is contaminated with infected stools or vomit, then it may spread to you as well. Now, for this reason, young children who are just starting to learn about hygiene, they are particularly vulnerable to viral gastroenteritis. So a young child, because they don't have much knowledge of hand hygiene or just hygiene in general, they may touch a soiled diaper or a dirty diaper, either their own or their friends, forget to wash their hands after using the toilet, or they may put dirty or soiled hands into their mouths. They may bite their fingernails or chew and suck on toys that are soiled or dirty. Parents and childcare personnel may also spread the virus from child to child, particularly if they forget to wash their hands after changing or managing or handling any soiled diapers. In addition, adults themselves who have viral gastroenteritis may pass it or spread it on to others when they forget to wash their hands or while they are preparing food for others. Gastroenteritis is easily spread in homes, daycares, kindergartens, and schools. Occasionally, Some of these viruses can be found in drinking water or food, particularly in developing countries where sanitation is not so good. Recently also, we've seen many news reports or media reports on norovirus, which is famous for causing outbreaks in cruise ships. How long does gastroenteritis usually last? Fevers and tummy ache and vomiting usually is short-lived, only about 2 to 3 days. But diarrhea may be a little longer. It can sometimes last more than a week. Sometimes people will also ask, what puts my child at risk for getting gastroenteritis or stomach flu? So gastroenteritis affects all age groups actually, but it's more common and more severe in young infants and children. Another factor that may put you at risk for getting stomach flu is not being vaccinated with the rotavirus vaccine. So remember to protect your child with rotavirus vaccine. Another factor is that being in daycare settings or in any situation where sanitation and hygiene may not be optimal, or even in very crowded places, puts you at risk for getting gastroenteritis. How would one manage stomach flu? The main treatment in stomach flu is ensuring that your child is well hydrated. Try to offer small amounts of fluids frequently rather than giving large amounts in one go. Try to keep giving fluids to your child even if they are vomiting. This should help prevent dehydration. So small amounts frequently. If you are still breastfeeding your child, do continue to breastfeed. And for the mother, a little advice is to take extra fluid yourself. If your child is on formula, do continue to offer formula, but do not force them, okay? They may have less appetite. If your child is over 1 year old, you may give them fresh milk or cow's milk if he or she would like to. Your pediatrician may also recommend an oral electrolyte replacement solution to help prevent dehydration. Now sometimes, if your child gets bloated or the diarrhea and vomiting get worse after drinking milk products, then your doctor may actually suggest a lactose-free beverage or lactose-free milk for a short period of time. This condition may be due to a temporary lactose intolerance caused by the gastroenteritis. So do consult your doctor and see if it is good for your child to switch to a lactose-free beverage temporarily. Your pediatrician may sometimes prescribe anti-vomiting medicine to help with your child's nausea and vomiting, if it is indicated. Some studies have shown that probiotics and zinc supplements may help in reducing the duration of illness. You may wonder whether you should continue to give or offer foods to your child. So what kind of foods? So you can offer your child food if their appetite is okay, even if the diarrhea continues. Continuing to feed your child with normal foods can help speed up the recovery process and may reduce the length of time your child has diarrhea. Your child may refuse foods at first because of the diminished appetite, but this is not a problem so long as they continue to take in extra fluids to keep them hydrated. Starchy, simple foods are best. For example, you can try and offer foods such as bread, potatoes, toast, porridge, rice, or plain biscuits. Lean meats or lean proteins are okay as well. The main thing is that you keep offering and trying various foods to help their condition. What are some of the foods or drinks that one should avoid when having gastroenteritis? Try not to give your child any overly sugary or fatty foods, such as takeaways, those packed foods that are very oily, fried foods, sweets, cakes, chocolate, ice cream, cream or coconut cream, or any undiluted soft drinks or fruit juices, or sports drinks, 100 plus, Gatorade, that kind of thing. This may contain too much sugar and not enough sodium and may make your child's diarrhea worse. Try to avoid coffee and tea as well, as they are considered types of diuretics and may make dehydration worse. Now, what are some of the signs to watch out for in gastroenteritis? So watch out for signs of dehydration. That include dry mouth and tongue, sunken eyes, cold hands and feet, unusual sleepiness or lack of energy, fewer wet nappies, or not passing as much urine as usual, usually less than 2 to 3 wet diapers in a day. If your child is less than 6 months old and is vomiting and having diarrhea severely, babies can become dehydrated very quickly. If your child is very drowsy, if there is blood or mucus in your child's poo, if your child is vomiting green bile or green fluid, if your child develops severe stomach pains, if your child's skin or whites of the eyes turn yellow, this is called jaundice. If your child's diarrhea continues more than 14 days, patients such as these may need to be hospitalized to receive intravenous fluids. So how can one help prevent the spread of gastroenteritis? The number one thing is frequent hand washing, especially after using the bathroom or handling dirty diapers, or even preparing meals. Avoid sharing of food and drinks. Keep sick children away from others to minimize spread of diseases. And vaccination with appropriate vaccines. In this case, the rotavirus vaccine. Well, we come to the end of this short video. I thank you for watching. I hope you enjoyed the video. Stay tuned for my next video. And meanwhile, take care and stay safe. Bye.